Good afternoon all. It's been quite late and I think everyone is eager to go home. But I think we've got 2 more sessions before we end the session today. Our topic today is Prescription for Physician Burnt Out Workshop. There will be 3 panelists. One is Dr. Sivanesan Pubalisingam, who needs no introduction. You have been introduced before. The next is Ms. Nisha Leshmanan. Just want to introduce a short bio of her. Ms. Nisha is a council member of Malaysian Society of Lifestyle Medicine, Director of Mind-Body Medicine at Amrita Integrative and Lifestyle Medicine Center. She specializes in treating musculoskeletal problems, diabetes, hypertension, cancer, and mental health issues like anxiety, depression, and stress. At Amrita, she collaborates with lifestyle medicine physicians to provide holistic health regimes, and she conducts stress management and corporate wellness workshops, and played a key role in developing the global information portal on traditional and complementary therapies for Malaysia's Ministry of Health. She recently led workshops on fall prevention and rehabilitation for elderly and organized by UNFPA, the Malaysian Ministry of Health, and also University Putra, Malaysia. Additionally, she writes articles on healthy living and has co-authored books with Dr. Siva and on mind-body medicine and healthy aging. I welcome Ms. Nisha. The other is Ms. Ivana Saldana, currently works for a furniture design and development company and has a long-standing interest in graphic design, which she has applied through her involvement with Malaysian Society of Lifestyle Medicine. This role has allowed her to use her creativity and develop her skills in visual communication. MSLM has also inspired her to explore mindfulness practice and lifestyle medicine, areas she is passionate about, and aims to understand deeply. She has been practicing yoga since her late teens, having been introduced to it in childhood, and is currently enhancing her knowledge in mindfulness and relaxation techniques at the Amrita Lifestyle and Integrative Medical Center, with goals of eventually sharing these practices with others. I welcome Ms. Ivana. So the workshop today is on prescription for physician burnout. Now, before we continue, now I just want to clarify that in ICD-11 of the World Health Organization describes occupational burnt out as an occupational phenomenon resulting from chronic work stress that hasn't been successfully managed, with symptoms characterized by feelings of energy depletion or exhaustion, increased mental distance from one's job, or feelings of negativism or cynicism related to one's job, and reduced professional efficacy. Now, how many of you all here feel such signs and symptoms? Oh, everyone is very happy with your job. Oh, I can see 1, 2, 3, 4. Okay. So what I'm saying is that you sometimes are not aware that you are actually burnt out, but you may suffer from such symptoms. All right. So I think we shall continue with. I pass the floor to Dr. Siva.
Good evening, everyone, and welcome back. So I'll just do a very quick introduction to the theoretical part of stress and burnout, and we'll spend more time on the workshop itself. All right, so we are going to talk about a little bit about stress and stress resilience, what is burnout, and the role of mindfulness in stress resilience, managing and preventing burnout. So we know that stress is the health epidemic of the 21st century. And according to the American Psychological Association, in a survey, 75% of adults reported experiencing moderate to high levels of stress. So how do we define stress? You know, we use that word very often, right? So we can break down the definition into 2 parts, and I'll tell you why. So stress, we can define it as the pressures of life, and the second part is how a person perceives, believes, reacts, and copes with these pressures. So why break down into 2? Because sometimes we can't actually control the pressures of life, right? So we can't actually control the kind of curveball that we're going to get. But we can actually reframe how we are going to view the stresses, how we are going to cope with these stresses. And obviously, a person experiences the effects of stress when the demands exceed a person's ability to cope. So when a person faces a stressful situation, right, so it is picked up by the amygdala, and this then activates the neuroendocrine and the sympathetic pathways, resulting in an elevation of the cortisol, adrenaline, and noradrenaline. Okay? Now, at the same time, what happens is that the parasympathetic nervous system is inhibited. This also leads to an increase in inflammatory cytokines, and you have a decrease in your neurotransmitters, serotonin, dopamine, GABA. You have gut dysbiosis, impaired immunity, and so on and so forth, right? Now, we know that stress accelerates aging and increases the risk of not only physical, but emotional and mental health disorders. So, if we talk about workplace stress, so in this study that they looked at workplace stress among healthcare professionals, so 68% experienced some form of workplace stress, and the more hours a person worked, obviously, they experienced more stress, right? And what are the causes of stress among healthcare professionals, right? Some of the causes, of course, we all know, right? We're just recapping: heavy workload, long hours, competition, demanding job, shift work, responsibilities. And something that is relevant to healthcare professionals is dealing with the suffering of others, all right? So that is something that is, particular to our profession, and we need to know how to cope with this. Because, you can't just distance yourself from your patient if the patient is undergoing, a lot of suffering, right? And what does this lead to, or rather, what do we experience when this happens? It increases incidence of anxiety, depression, suicidal ideation, leads to poor quality of life, low life and work satisfaction, poor self-care, all right? And poor health, finally leading to burnout, all right? So what do we mean by burnout? So according to the psychologist Friedenberger, he coined the term burnout, which describes the symptoms of emotional exhaustion, all right? So burnout indicates prolonged exhaustion in both physical and psychological stress, and leads to the deterioration of emotional functioning in a person, which leads to then a decline in their professional commitments. So WHO now has a criteria for burnout, all right? So the criteria includes 3 symptoms: exhaustion, cynicism, and reduced performance at work, all right? Now, burnout is not only linked to health problems, it also can ruin relationships and jeopardize career prospects, right? Now, in a publication in the Journal of Clinical Psychology, they found that burnout, or rather they term burnout to be work-induced depression. And higher the burnout, the more the depressive symptoms, right? And in another publication, 90% of those who scored high on a burnout score met the criteria for a provisional diagnosis of depression. I'll skip that. And now, in a review on physician suicide, a call to action in the United States, they found that 400 physicians die by suicide annually, which is double the number of the general population. So this is very significant, right? So obviously, if you have a healthcare that is burnt out, right, this is going to impact the healthcare, right? Now, what are the negative impact? There's negative impact on patient care, increased incidence of medical errors, reduces the ability to empathize with patients, and decreases the ability to connect with patients, right? So when someone has burnout, what happens in the brain, right? So the amygdala, the sensor, gets enlarged, and there's a stronger stress response. There's also a reduced connection between the amygdala and the prefrontal cortex, which actually makes decisions, okay? So how do we deal with this? We need to then develop the stress resiliency, right? So what's stress resiliency? It is the ability to cope with life's challenges and to adapt to adversity. Now, important thing or the good thing about this is that it can be trained. You can be trained to improve your stress resiliency. Basically, what you're doing is you're down-regulating the amygdala. You're improving the connection between the amygdala and the prefrontal cortex. All right? And so resilience is, I just mentioned that, okay? So how do we do that? Right? So we need to reset our mind. So how are we going to reset the mind? Reset what we are used to. Reset the way we do things as usual. So if I ask you a question, are you all mindful or mindful? That means, does it end with a double L or with a single L? Where are you all? Who ends with a double L? Okay, Dr. Prakash says double L. Quite a number say double L. So the mind is full of stuff, right? So a lot of our stress is obviously related to what we think, whether real or unreal. Sometimes it's perceptions. So what we want to do is we want to declutter the mind that is full of things, and we want to become mindful, right? So the term mindfulness was developed by this doctor called John Kabat-Zinn, right? And it is actually the psychological process of bringing a person's attention to the current moment. That means if you're listening to my talk, you're focusing on the talk. But more often than not, while you're listening to a talk, you're thinking of what you're going to do after the talk, what happened earlier, because the mind wanders, right? So the wandering mind is what gives us a lot of issues, right? So mindfulness is the art of staying in the present moment, and focusing on the present moment, not being too obsessed about the future or the past. So basically, when we do mindfulness techniques, right? So mindfulness is a state that is brought about by practices such as yoga, meditation, etc., breathing techniques. So what you're doing actually when you do these techniques is, you see, our mind is like a monkey. It's got a lot of monkeys inside. And the problem is the monkeys control us. We follow the monkeys. We are not able to tame the monkey. It's very difficult. So what we do is we distract the monkey. So when you do breathing technique, what are you doing actually? You are focusing on the breathing. Okay? So when you focus on the breathing, then the monkey doesn't do its continuous chatter. All right? And mindfulness extends to not just sitting and doing practices, but it's also like mindful listening. See, we all have this habit of when someone is talking, you're already ready with, your mind is formulating all kinds of answers. We tend to do that, right? Same thing when you're eating. Sometimes we eat, we don't savor the food. So mindful living is about doing things mindfully, right? So when you practice any of these practices, what we are doing is we are up-regulating the parasympathetic nervous system. If you remember at the beginning, I said that when we experience stress, we switch off the parasympathetic nervous system. So now we have forgotten to switch it on. So what these techniques help us do is to help us to switch on the parasympathetic nervous system, which then brings about the relaxation response, which is actually our body's natural counterbalance. So we are just bringing the body's natural counterbalance back into play, right? And this then reverses the experiences that come along with stress, right? So among the benefits of mindfulness are dampening of the physiological response and a quicker recovery. It also includes benefits in the neuroendocrine, immunological, inflammatory, and cardiovascular system, helps to promote longevity, improves cognitive skills. Now, beyond that, mindfulness or, upregulating your parasympathetic nervous system and evoking the relaxation response also promotes development of self-awareness and discipline, which is required for behavior modification. This also promotes self-care.